Hi, I'm Dr. Kelly Starrett with the Ready State. Oftentimes we are reaching for H-wave because we're finding ourselves with congestion or swelling or pain. And in this pain situation, oftentimes we're thinking, hey, I need to get out of pain. That's my top priority. And what we end up forgetting is that there's a lot of things that we can do that can work in adjunct or in tandem with treatment with the H-wave. So remember that with H-wave, I'm working on decongesting. I'm working on sort of signaling to the body that it's safe to create movement here. And potentially I have access to on-demand pain relief using high frequency. But there are some things I can do that work upstream and downstream of my targeted pain site that may cause me to feel better. And also that may simply shift loci of control back into, hey, there's a lot of things I can do to make myself feel better or to self-soothe. Specifically, we're talking about soft tissue mobilization. So oftentimes, if someone has knee pain, for example, what we think is the worst. I must have injured my knee, I need an MRI, it's gotta be the meniscus, it's gotta be some kind of complex mechanism inherent in the knee that could be driving the pain. And oftentimes, while that may be true, there are huge amounts and big swaths of tissue that I could potentially impact to change how my brain is interpreting what's going on. And an easy way to do that is to engage with some isometrics or some sort of pain isometrics, which allows my brain to sort of think differently about the input that's receiving from the sort of offended tissues. So, for example, if I've got knee pain, it might think to myself, hey, what is upstream of that knee? And upstream is my quadriceps. So what I'm telling you is that if I have trigger points, if I have sensitivity in this quadriceps area that could absolutely trigger or be referring or be kind of part of that command and control that's signaling to my brain that I have knee pain. And so impacting that tissue directly with some isometrics, which I'll show you, can be very, very palliative. It can help me feel better and restore function to that movement system. The same thing is true downstream of the calf, for example. If my calf is restricted, it can absolutely drive and cause dysfunction or pain in the knee. So what I'm going to show you here is that a reminder that oftentimes if you're having pain in a joint or tissue system, to work upstream and downstream. And what we like to do is say this: the resting state for a tissue system should be discomfort or pain-free, which means as I roll across an area, in this case below my knee on my calf, I'm just rolling on a generic roller here and I'm rolling side to side. None of that should be uncomfortable. It should just feel like compression. And so a simple rule is that my tissues should be painless to compression, pretty moderate compression. And so if I roll side to side and I discover something that feels uncomfortable, right there, that feels a little uncomfortable, I don't have to go anywhere. I stop there. It doesn't mean something's wrong with me, but it means, hey, some part of this tissue system is sensitized. And so what I'm gonna do is a simple technique called contract relax, which is just an isometric, which means I'm gonna take a big breath in, I'm gonna contract over the area that I'm working for 4 seconds, 4 or 5 seconds. Hold that, hold that, hold that, build some nice tension there, block the roller out, tell your brain it's safe to function in this tension and load, and then I'm slowly going to exhale for 8 seconds, really long exhales that are much longer, twice as long as my contraction, as I soften and relax. And I'm going to repeat that cycle. Take another breath here. I'm going to take a big breath in. I'm going to contract again, and I'll hold that for 4 or 5 seconds, and then I'm going to exhale and slowly soften. Again, repeating that cycle for 2 or 3 revolutions, 2 or 3 cycles, until it starts to feel different. And what ends up happening is now my brain has said, hey, it's okay there, so I start moving on. And what we found is that engaging in this kind of pain isometric, where I do a breath, I do a little isometric hold, I flex into the roller and I relax, can give me real relief in working on systems that are upstream and downstream of an area. And it might be confusing to us because some of us don't carry around graduate degrees in the body, but you might be surprised to learn that stiff adductors might drive knee pain, or stiff on the inside of your calf can be causing ankle pain. We want to be thinking of the body as a system of systems, and if I simply remember to work upstream and downstream, looking and scanning side to side for painful areas, for about 5 minutes a tissue system. If I find something, I contract and I relax and repeat that cycle a few times, and I can make myself feel better. And that can be a very powerful adjunct into also managing congestion, getting non-fatiguing muscle contraction, and some on-demand pain relief. Because ultimately, the goal is to restore your body's ability to move innately and freely and in a pain-free way.